So guys, today I have good news and bad news. So some of us will be asking, Blessed, OgBlessed, what's the problem? Like, why the good news and the bad news stuff? Now we all know that Nigeria is part of the many African countries that has had its fair share in the recent outbreak of cholera. Yeah, it's so very devastating. Like 2024 alone, not only that we are having economic crisis, we're also having some pandemic. Is it epidemic? I don't know, just having some kind of health crisis in Nigeria. 1st of January down to 29th of September, Nigeria has had over 10,000 cases of cholera, like, patients. And within that 10,000 cases, over 300, mortality case, like over 300 patients dead. And it's so bad that it hits across the states, all the states, like across the 33 states of Nigeria, and including the capital too. So, and as of September, Enugu State was the only state without a recorded case of cholera until, of course, late September, early October. Enugu actually recorded its own case of cholera outbreak, and that's how bad it is. So having known this knowledge, some of us will be asking, like, okay, if this is actually bad, so what is cholera? Yeah, cholera is a very deadly bacterial infection that is actually caused by a bacterium called Vigro cholerae. Vigro cholerae is the bacterium that is responsible for the cause of cholera, and it's being caused by contaminated water, taking contaminated like water. And onto the symptoms of cholera, most cases of cholera actually come with symptoms ranging from mild to severe, like severe diarrhea, which is actually very hard to actually differentiate from diarrhea itself. And while others can actually show a range of really bad symptoms within few days or weeks of contacting the cholera bacterium. So the symptoms of the cholera infection as follows. 1, diarrhea. As I said earlier, it can actually range from mild to very severe diarrhea. And then we have nausea, vomiting, and vomiting, dehydration, chronic dehydration, electrolyte imbalance, which can come with muscle cramps, body sore, and yeah. So it's actually very, very, very like terrible. These symptoms are very, very terrible. So as said, what are the causes of cholera? As the overview I gave earlier on, is actually caused by a bacterium, the cholera bacterium, which is the Vibrio cholerae. And there are other ways by which one can be contaminated and actually get like the cholera or be infected by the cholera infection. And we have one taking from wells too, like taking contaminated water. This contaminated water can be in public places, example from wells, because I mean, we can live in communities that are very, very unhealthy and and very dirty places. So when there is rainfall and all these things, water can actually be swept from a lot of places and down, dump it maybe into the well, especially for those of us that don't close our well. That's very, very bad. Yes, secondly, eating seafoods. A lot of us that love seafoods, fishes and crabs and the rest, because you don't actually know where they get these seafoods from. You don't actually know where they get this fishes or crabs from, and it can actually be in the place exposed to the cholera bacterium, and then taking them without processing them very well, cooking them very well, boiling it very well, or refrigerating it very well, can actually like affect you, can actually like contaminate you with the cholera infection. And then also eating raw vegetables and fruits without washing them very well can actually these vegetables or fruits can actually be contaminated, and then you taking them without washing them very well, or taking the appropriate hygienic method on them can actually like expose you to the cholera infection. And lastly, grains. It's so very heartbreaking because Nigeria is actually a country that is being known to grow grains. We grow our rice. That's why we have much cases in regions in Nigeria where there is high rainfall, because you growing greens, the place has to be swampy in an open field, and which means someone can go take a dump there, and maybe someone infected with the cholera can actually like go take a dump there, spreading this infection, spreading the bacterium all over. And another reason why cholera is actually very high in greens when being exposed to the bacterium is because during the storing process of these greens, it's not actually being checked. It's being stored in a dry, cool area, giving the bacterium time to actually grow and and also multiply or spread. Risk factor for cholera infection include as follows: one, poor sanitary condition. When you are living in a very unsanitized area, maybe especially places exposed to natural disasters such as flooding or landslide, and constant rainfall, this can actually like help move, as long as you're being exposed to a lot of watery environments around you, can actually expose you to the cholera infection too. And when you don't keep your environment clean and safe, you're actually exposing the next generation. If you have kids around you, you're actually exposing them. You're also exposing yourself to a victim of cholera. And then another risk factor is when you have reduced or little stomach acid. Well, while this can actually not be very efficient, but it can actually help in saving you from having the infection. That's because your stomach acid, that the HCl, that the chloric acid, actually has the ability to break down and to kill this bacterium once it enters into your system. Once it enters into your system during eating or when you take contaminated water. I'm not saying that you take it, but once it enters into your system, the HCl, if you have enough HCl in your body, like in your stomach, if your body produces enough HCl, it can actually like kill the bacteria before it spreads. Thirdly, for some reasons, which is not very clear though, people with blood type O are more at risk of having the cholera infection, twice as risk of having the cholera infection than people compared to other blood types. So it's actually very, very, very crazy. If your blood type is type O, you are very much at risk. So you have to keep your environment clean. So what are the complications of cholera? Cholera can be very devastating. It has a whole lot of devastating complications, ranging from hypoglycemia, when it can actually lead to low blood sugar levels. That's because you are actually getting constantly dehydrated, losing body fluids, diarrhea. And then it can also, secondly, cholera, if left untreated, can actually cause hypocalcemia. That is low calcium levels. You're losing a lot of fluid, obviously, via diarrhea. So the calcium level in the body is actually going to be lowered. And then, which can in turn, when there is hypoglycemia, when there is hypocalcemia, it can actually, you're affecting your body fluids, and which is not very good for your kidney. So thirdly and lastly, it can actually cause kidney failure. Kidney prevents cholera. One, make sure your environment is clean. Those of us living in public places or places prone to waterline places or riverine areas, try your best to take away contaminants around you. Keep your trash can away from where you have your water, and make sure that it's advisable that there should be a long distance between where you go and drop your dumpings and where the source of water is, the river or wherever. There should be a very long distance between them to avoid leakage from sewage down to the source of water or source of drinking. Make sure you boil your food properly, and yes, both boil your food properly, boil your water properly, and stay safe. And lastly, guys, please get vaccinated. Go to the nearest primary health care center around you, or you can go to the hospital to get vaccinated and get your immune system boosting. And stay safe, guys. One of the ways we can defeat the cholera outbreak in Nigeria is by making sure that our environment is clean, our waters are free from contamination, make sure you cover your wells. Do not go around littering or dropping your dumplings everywhere to avoid contaminating the next generation, contaminating yourself and others. And if you're infected, there's no need for you to there's no need for you to like panic or feel or give up on yourself. Just go to the hospital and get the necessary treatment, right? So stay safe. Please share this video, like, subscribe, and drop a comment below on what you think of this recent cholera outbreak in Nigeria. And stay safe, guys.